Kenya has recorded a stagnation of neonatal deaths, this following the introduction of oxygen therapy in hospitals. Before the COVID-19 pandemic, most hospitals in Kenya lacked medical oxygen. This deficiency posed a significant threat to patients, especially infants with respiratory conditions. However, the pandemic spurred an urgent response that has transformed emergency healthcare delivery in the country. Here's how the situation has changed. A baby's first cry, the joy of the mother and father of the baby. And to a neonatal nurse, one of the indicators that the baby is in good health. But in some cases, a birth is not accompanied by a cry, mostly because the baby is struggling to breathe. We find a mother watching over her baby who was born prematurely. In Kenya, approximately 134,000 babies are born prematurely every year.
Mtoto wangu alikuwa hali yake si nzuri, alikuwa anapumua vibaya. Sasa akaikwa oxygen na sasa anaendelea vizuri.
One of the leading causes of newborn death worldwide is birth asphyxia, or inability to breathe at birth.
Nilikuja hapa kutoka on Sunday nikiwa na shida ya pressure. Kufika nilisaidika, nilipata mtoto although hakuwa amefikisha months, ikawa vile alitoka kuna shida ya kubreathe. Wakati nilitoka theater kukuja hapa alikuja kuwekwa kwa oxygen.
Garissa County is an expansive county. Expectant mothers in the region travel long distances, sometimes under harsh conditions, to deliver their babies in hospital.
The babies we usually admit come with respiratory distress, birth asphyxia, meconium aspiration syndrome, and these are babies who need oxygen for survival. We also have babies with pneumonia.
Hypoxemia is a low level of oxygen in the blood. It causes birth asphyxia. The risk of death in hypoxemic children is 7 times higher in places like Garissa. The county has the highest maternal mortality in Kenya. There's an influx of preterm babies with different medical challenges arising from their weight and complications from birth admitted to the 20-bed capacity neonatal intensive care unit. At any given time, the hospital's NICU has at least 17 babies in a ward with a maximum capacity of 20 babies. The number can sometimes go up to 40. This mother has been admitted at the Naivasha Sub-County Referral Hospital for over a month.
Safari ya oxygen kuna challenge sana. Sababu huyu mtoto ni mdogo, kuwekwa hizo vitu kwa mapua. Unaona mtoto ni kama anateseka, lakini inamsaidia, inabidi uvumilie sababu inamsaidia. Ilimpa uwezo wa kupumua kwa hiyo muda wote, hangejiweza peke yake. Juu viungo zake za mwili mingi haikuwa imekomaa kama mabafu.
Away from neonatal deaths, at least 3,000 people are killed annually on Kenyan roads, mostly occurring on Kenyan highways like the Nakuru-Nairobi highway.
We have experienced quite a number of road traffic accidents because this is normally a hot spot. The government, both national and county governments, saw the need to have liquid oxygen in hospitals, and this supported us in terms of delivering care to those patients who are in our isolation centers. Post-COVID, the systems are still being used in the hospital, and this has positively impacted in our system in terms of giving quality care to our patients.
In emergency situations such as these, healthcare providers in hospitals must identify the golden hour, a term used in emergency care to suggest that the patient must receive definitive treatment within the first 60 minutes. Conditions such as birth asphyxia are preventable if health workers are trained and have the right equipment to resuscitate newborns and stimulate breathing post-delivery. 10 to 15% of all children admitted to hospital require medical oxygen. Healthcare workers need specialized training of intubation, which is inserting a tube through the mouth, nose into the trachea, through which oxygen can be delivered, resuscitating and administering the oxygen to the baby.
According to WHO, we lose up to 15 to 25% of the neonates that suffer high asphyxia. And those that survive, up to 25% of them will live with neurologic defects, which are quite permanent. Oxygen is a drug just like any other, so the prescription needs to be clear. How much of oxygen are we supplementing? How much period of time are we going to give these neonates? And so is any other patient. For what duration of time? How are we going to monitor? How are we going to tell that it is enough, we need to wean off, or we need to increase, we need to lower the rates and such. It also talks about the devices. What are we going to use? It is very critical when it comes to immediate response and resuscitation.
The Ministry of Health, in collaboration with USAID and counties, is training healthcare workers in the country to have protocols to ensure the oxygen machines are maintained adequately, as well as how to supply oxygen to other hospitals.
Looking up to that level, that neonate, that patient that is in deep areas of the far-to-reach counties, the likes of Marsabit, the likes of Garissa, Turkana, Kitui, and such like. These people require quality care, just as a patient who is within Nairobi and the environs would get. So our focus was so much into training and capacity building these healthcare workers in those far-to-reach areas. You realize that once a patient requires that care in those areas, they require that first-hand resuscitation or other response. Then there's the referral. What is needed for this patient, even as they go to other level? You need to check with the other facility that you wish to refer to ensure that what is required is available at that point.
Findings by the Clinical Information Network, KEMRI, show that out of 132,737 children's cases in hospital in the country, only 1 in 2 had a pulse oximetry measurement taken at admission. Of the children who received oxygen, only 1 in 10 had low oxygen, yet they did not need it. 87% oxygen use was not guided by pulse oximetry, and more than twice as many children prescribed oxygen did not need it. According to the Ministry of Health, the demand for medical oxygen has increased significantly since the COVID-19 pandemic.
If I may go back to the pandemic, to the recent pandemic, that is the COVID-19 pandemic, in fact, the people were dying because of lack of oxygen. And while even patients were being transported for Nairobi, the people were dying in between those hospitals with the oxygen plant and this hospital. And this now has been averted.
The increased production capacity has improved oxygen affordability, particularly for maternal and child health care, and enhanced primary health care support.
We have seen it has brought a very good impact. For all the patients who need oxygen are getting, and most of them get improved very fast.
It has really helped us to manage these patients, and this has helped in reducing the mortality rate of our patients, and the management of our patients has become easier.
In the last 2 years, PSA oxygen generators have been installed in hospitals across the country to deliver oxygen to bedsides. Improving access to oxygen and administering oxygen can reduce child mortality from pneumonia by 35% and lessen fetal distress. It can also help manage emergencies by saving lives.